Hi everyone, and welcome to TS Fibro. Today's video is going to be on number 19 of the Introduction to Fibromyalgia, which the Introduction to Fibromyalgia video is towards the bottom of my videos, and it's itching with fibromyalgia. Are you losing your mind from scratching an itch that just won't go away? It could be your scalp, the back of your neck, or behind your ears, legs or feet, or even just one finger could itch like crazy. And let's not forget the unmentionables as well. It's that itch or feeling of bugs crawling on you, sometimes tingling, and often leading to pain. Fibromyalgia itching is one of the stranger symptoms of fibromyalgia. So strange, in fact, that some patients complain that their fibro doctors have never heard of it. Yet forums are filled with the same message. Thanks so much for posting this. I thought I was losing my mind. I wake up in the middle of the night scratching, and when I get out of bed, there are dried blood spots all over my sheets. Some fibromyalgia patients post what their doctors, including rheumatologists, offer as an explanation. And do you know what's funny? All the answers are different. What causes fibromyalgia itching? One explanation for fibromyalgia itching is called formication, which is a sensation that feels like bugs crawling on or under your skin. Formication is actually a paresthesia, which is a sensation that, like numbness, tingling, or burning, that happens when sustained pressure is placed on a nerve. The feeling quickly goes away once the pressure is relieved. Some individuals may experience chronic paresthesia. This is usually a symptom of severe underlying conditions. Always consult your doctor whenever you have something out of the ordinary. Please don't just blame it on fibromyalgia. If you're not feeling easy about it, always go to your doctor. It's better to find out that it's not anything serious than it to be serious and not find out. Another explanation for fibromyalgia itching is metal toxicities that accumulate in the body and are a large contributor to fibromyalgia symptoms, including rashes and itching. The best and most non-invasive way to examine toxicity levels in the body is through hair analysis. Further explanations include irritated or damaged neurotransmitters that manifest in a number of ways, such as burning or itching. One patient even discovered that large amounts of salt contributed to her fibromyalgia itching. Adding to confusion, it seems that every fibromyalgia patient experience is different when it comes to the symptom of itching. So it makes sense that explanations would run the gamut. Nevertheless, it is a very real symptom that fibro patients often encounter. Because fibromyalgia and chronic fatigue syndrome involve the central nervous system, we get all kinds of strange things going on with our nerves, along with burning, tingling, numbness, and pinpricks. We can experience itchiness that can be severe and persistent. It's maddening, especially since scratching doesn't do a thing to help. For those with a pain type called allodynia, which causes touch to hurt, scratching and itch can make the whole area scream with pain as well. One fibromyalgia survey published in the Clinical Rheumatology Report reported itchiness without a known cause in about 2% of patients. However, they only looked at symptoms the patients had reported, and it's possible that this symptom isn't always reported. Several of our symptoms can fly under the radar, with few people realizing it's tied to this illness. Why do we itch? We don't have much research into this specific question, but it's likely that we itch because our nerves, and in fact, our entire nervous systems aren't normal. Many of us with these conditions have a symptom called paresthesia, which is abnormal nerve sensation. That's also why we get pinpricks, burning, tingling, etc. It's usually caused by neuropathy, which means damaged nerves. For a long time, researchers were perplexed by this because it didn't appear that we actually had nerve damage. Now, however, there's some evidence that we do. In fibromyalgia studies have revealed small fiber neuropathy, which is damage to specific parts of certain nerves. The research team of Anderson, Burke, and Mays has suggested a link between chronic fatigue syndrome and an immune system inflammation that's known to cause neuropathy. There's something else to consider. Narcotic painkillers such as hydrocodone, oxycodone. Itchiness is a known side effect of these medications. So if you take them for pain, be aware that they could be the cause of your itch. Of course, lots of things other than nerve dysfunction can make you itch. So it pays to make sure your itch isn't caused by one of them. If you notice any skin abnormalities, you should talk to a doctor about it. Also, watch for associations between your itch and food, skincare products, and other potential allergens. No matter the suspected cause, you should let your doctor know about your itch. They may be able to help you find successful treatments. Like I always said, always talk to your doctor. If it's something out of the ordinary for you, don't automatically assume it's part of fibromyalgia, especially if it's persistent or severe. Make sure you talk to your doctor. The central nervous system, or CNS, compromises the brain, spinal cord, and nerves. The CNS communicates information all around the body through a network of nerve cells. Scientists think that people with fibromyalgia experience changes in the way that the CNS, central nervous system, processes their pain messages. These changes may develop because of high levels of certain brain chemicals called neurotransmitters, which signal pain. Researchers also believe that the pain receptors in the brain can develop a muscle memory of the pain, which can cause them to become more sensitive and overreact to pain signals. Itching may occur because fibromyalgia activates certain nerve fibers. Itching and pain share a common pathway that runs through the spinal cord. Pain and itchiness also activate the same sensory brain areas. A person who is sensitive to pain may also have a sensitivity to itchiness. Constant itching may set off a scratch-itch cycle. Initially, scratching relieves the itch, but continual scratching damages the skin. This damage makes the itching worse, so the person scratches more, resulting in increased itchiness. People with fibromyalgia have unusual levels of neurotransmitters, dopamine, noradrenaline, and serotonin in the brain. These substances play a role in regulating pain, sleep, mood, and thinking. Neurotransmitters are chemical messengers that control communication throughout the brain and body. Research into serotonin's role in the skin found that abnormal levels of serotonin cause itching in mice. The researchers also noted that when the body releases serotonin in response to pain, this activates certain receptors that cause itchiness. Scratching the itch causes the release of serotonin as a pain reliever, which activates the receptors again and causes more itching. Just remember that medications for treatment of fibromyalgia can cause itching in some people. These drugs include pain relievers, antidepressants, and anti-seizure drugs. For example, Tylenol. This drug can cause skin rash, hives, or itching in rare cases. Ibuprofen, Advil. Itching is a common side effect of ibuprofen. Naproxen or Aleve. Many people who take this medication experience itching as a side effect. Tramadol. Itching skin is a common side effect. So ask your doctor Cymbalta and Lyrica does also. But ask your doctor about the medications you're taking to see if maybe that's what's causing your itching and not necessarily the fibromyalgia. If a person notices itching after starting to take fibromyalgia medications, they should speak to a doctor. The itching could be a sign of an allergic reaction. In some cases of itching, the doctor may adjust the dosage or recommend an alternative medication. Persistent itching can interfere with sleep, and a lack of sleep could worsen symptoms of fibromyalgia. Continued scratching may also result in infections. Here are some home remedies that you might try. Moisturizing the affected area at least once a day, especially after bathing or showering. Avoid perfumed products such as scented soaps or moisturizers, lotions. Using cooling creams or gels on the skin. Applying anti-itch creams or lotions in short term. These should contain at least 1% cortisone. You can also try calamine and capsaicin may also help. Using anesthetic skin creams and lotions such as Caladryl to reduce itching. Trimming your nails, wearing gloves at night to prevent scratching. Applying cool, wet compresses to the affected area. Taking a lukewarm bath with baking soda and uncooked oatmeal. Minimizing stress through therapy or relaxation methods such as meditation or yoga. Aiming for comfort by wearing loose clothes and keeping the bedroom cool at night. A person with fibromyalgia, if you are experiencing persistent itching, you should speak to the doctor about your symptoms. Medications. There are no guides for treating itching in people with fibromyalgia. However, a doctor can provide treatment once they establish the cause of an itch. Medications to manage pain often reduce itching too. Medications to treat fibromyalgia pain include pain relief medications, acetaminophen, some more remedies that might help. Now remember, this is all trial and error process. While one person may swear by a medication or treatment, others will say that particular item did nothing for their itching. So let's look at some more. Antihistamines such as Zyrtec and Benadryl taken daily, usually at night since many experience drowsiness. The added bonus is that it can help you sleep through the itching, although some people have to take it twice a day. A 24-hour time-release pill may resolve that issue. Topical antihistamines do not appear to be effective for itching associated with fibromyalgia. So remember that. Also, if you need to ask your doctor about the Benadryl and the Zyrtec, because a lot of those antihistamines will increase your heart rate. And like with me, I had high heart rate, so my doctor took me off Benadryl, told me not to take it anymore. So just remember that and ask your doctor. Topamax is actually a prescription medication for migraines, but some fibromyalgia patients found that it took the fibromyalgia itching away. Covering up with clothes, including long, comfortable cotton pants, shirts, sweaters, which most of us can't handle, but it could work for you. For the scalp, many use treatments that are often recommended for dandruff, such as Head and Shoulders. Palmer's coconut butter formula with vitamin E skin therapy oil. People report that it absorbs into the skin very well and doesn't leave a greasy feeling behind. Also, Palmer's coconut butter moisturizing baby oil used after a bath. It's very helpful, although it briefly leaves the skin greasy or slick feeling. Pressing as hard as one can on the spot that is itching. This leads to the relaxing of the muscle, which lessens the fibromyalgia itching. Limiting caffeine. Hypoallergenic soaps, such as Aveeno, Gold Bond medicated lotions after a bath or shower with hypoallergenic soap. Ativan is an anti-anxiety prescription that is commonly reported to relieve fibromyalgia itching, although it can cause grogginess. Eliminating aspirin, eliminating ibuprofen. Gabapentin is a prescription medication to treat seizures and pain caused by shingles. Some people, even marijuana by smoking, vaping, or eating has been widely reported as a very effective treatment for fibromyalgia symptoms, including itching. Now remember, everyone is different. This is trial and error. So don't get discouraged if something doesn't work for you. Just keep trying. Just keep trying different stuff until you find something that works. And also consult your doctor, because he can suggest things also that can work. Many fibro patients take Lyrica, as it is one of the most common medications used to treat fibromyalgia symptoms. However, a common side effect of Lyrica is that it can cause itching. If you already deal with the symptoms, you may want to try a different medication that does not include a side effect which exacerbates a severe problem. If you take opiates to relieve pain and symptoms related to fibromyalgia or other issues, be aware that opiates make itching drastically worse because they release histamines. Okay, everyone, that's it with the itching. And also, that was the last one on the introduction to fibromyalgia. Now, as all of us with fibromyalgia know, there are a lot more symptoms than 19, but I just put 19 on the introduction to fibromyalgia. But I will be going over making videos on other fibromyalgia symptoms. If you have a symptom that maybe is unusual or different, you might think you're by yourself, but you probably aren't. So if you want to email me, you can at tsfibro@aol.com, or leave me a message down below. And also, don't forget to subscribe so you can and hit that notification bell so you can get notified when I put up a new video. Also, if you like the video, hit that thumbs up for me. I appreciate it. And welcome back to all my Fibro family, and if you're new, welcome to our Fibro family. I hope everybody has a great day. God bless. I pray for a cure, and I pray you have a pain-free day.